Hi everyone, welcome to the class of Pediatrics Kids Discovery. Myself Dr. Parv Luthra. The topic of discussion for today's class is approach to a child with ataxia. So let's understand about the approach to the child with ataxia. So see, actually ataxia is a very big topic, very big topic. But I have tried to summarize ataxia in a small video so that you are able to understand like what ataxia is all about. So ataxia, as I said, is a broader domain, but I've made this video a smaller video so that you can understand what is ataxia and you can write in your exam also. So I've made it in a concise portion. So ataxia is nothing but lack of voluntary coordination of the movement. Okay. So voluntary coordination is absent in case of ataxia. So what is the clinical presentation? See, of course, there will be gait impairment which is going to be there. And in ataxia, there is some speech problems also, like the scanning speech, like the unclear speech. There's going to be eye issue as well, that is going to be nystagmus. There is going to be incoordination of the hand as well, and of course there's going to be tremors which will be there with the movements. So there will be tremor, there will be incoordination, there is going to be nystagmus, there is going to be gait impairment, and there is going to be what? There is going to be speech issues as well. So this is the mnemonic to understand, to retain all the examples of your all the presentations or all the manifestations of your ataxia. S for speech, T for tremors, I for incoordination, N for nystagmus, G for gait impairment. So, coming on to ataxia. Now, please understand, ataxia is actually a symptom, but the problem is either in the cerebrum or in the cerebellum or in the brainstem. Okay, clear? So, the problems which are going to come, I've already told you. Coming on to what do you mean by true cerebellar ataxia? See, if the problem is because of the cerebellum, it is something which is called as cerebellar ataxia. But there are some other ataxias also, like vestibular system ataxia. Vestibular system, vestibule, you very well know that it is present in the internal ear, which is associated with vertigo-like functions, features like dizziness-like features. There will be lightheadedness also which is going to be present, which is not seen in cerebellar ataxia. So very simple, if you want to ask the patient if he is having a vestibular symptom or if he is having a cerebellar cause, if he is having a cerebellar cause or a vestibular cause of ataxia, you can easily simply check it out with the help of lightheadedness. So if there is lightheadedness, there is going to be what? There is going to be vestibular. Okay, vestibular is going to be there in lightheaded. Vestibular is going to be the cause. What is sensory ataxia? Now, sensory ataxia means, see, sensory ataxia I can teach you with the help of a Romberg sign. I just hope I have got a picture of Romberg. See, what is Romberg test? Romberg sign. What is it? So, if the eyes are open and I ask the patient to join the feet, the patient is easily being able to join the feet when the eyes are open. But when I ask the patient to close the eyes, the patient can't stand tall. The patient is unable to stand tall. Okay. So, ask the patient to stand with the heels together, first with the eyes open and then with the eyes closed. And then you have to note down any excessive postural swaying or loss of balance. If there is present when the eyes are open or closed, like in any state it is present, it is going to be cerebellar ataxia. But if it is present only when the eyes are closed, this is something which is called as positive Rombergs, and this is going to be sensory ataxia. So in alphabets, P, Q, R, S, R and S come very close. So if the Romberg test is positive, this is suggestive of what? This is suggestive of sensory ataxia. This is suggestive of what? This is suggestive of sensory ataxia. Now, please understand what are the different causes of ataxia. So one I have told you cerebellar, other I have told you vestibular, the third one I have told you sensory. Now coming on to the different causes. Now for example, if the ataxia, now this is important when it comes to the part of history taking as well. If the symptom of ataxia is gradual, if it is bilaterally symmetrical ataxia, then it can be more of a systemic disease like genetic disease. So genetic disease is something which is going to involve bilateral sides, okay, metabolic diseases, immune mediated diseases, drug toxicity. So all these are going to have bilaterally symmetrical gradual ataxias. Now, ataxia because of space occupying cerebellar lesion. So, for example, if there is a space occupying lesion, like for example, if there is a cyst which is there, if there is a tumor which is there, if there is a, okay, so these are the space occupying lesions. Now, if they are present with ataxia, they will have some other associated features also, like headache, like altered mental status, like ipsilateral cranial nerve palsies. So all these things are actually going to be there in the space occupying cerebellar lesions. Now next comes the symmetric ataxias. Now symmetric ataxia means there's going to be loss of coordination that is going to affect the both sides of the body equally, like both arms, like legs, both trunk. So this is something which is symmetric ataxia. So this was, I mean, I've incorporated because once it was asked in your exam. So symmetric ataxia is this. Now by the time course, you can divide the ataxia into three parts: acute ataxia, acute and subacute ataxia, subacute symmetric ataxia. Okay, so these are the different things, like chronic asymmetric ataxia. So just remember this. For example, if it is happening because of consumption of any substance, okay, so PLAB is an exam which people give in order to get admission in UK. So what is PLAB mnemonic? P for phenytoin, L for lithium, A for alcohol, B for barbiturates. This is because of acute cause. Okay, this is the acute reasons. Coming on to the subacute now. So now toluene and the sniffing agents and the 5-fluorouracil, paclitaxel, all these things can be either acute or subacute, but you have to remember that you have got the toluene, 5-fluorouracil, paclitaxel, and then the sniffing. All these are actually the subacute ones. Okay, acute or subacute. Out of these both are really important, 5-fluorouracil and paclitaxel. Please remember, these are the chemotherapeutic agents responsible for causing ataxia. 5-fluorouracil and paclitaxel. Okay, these are really important. Please don't forget them. Okay, so and in fact, you can remember that they are going to have words like CIL, XEL. So LL is actually coming in the last part, and in Hindi disbalance is something which is called as ladkhadana. Okay, so this is how you can remember, like 5-fluorouracil and paclitaxel. Then what are the subacute? So subacute means it is not acute, but it is not chronic also, somewhere in between. So what are the causes? Like Prine's disease. Now Prine's disease can be there. There can be like, immune mediated conditions like gluten sensitivity. So this gluten sensitivity is going to have some antibodies which are called as anti-gliadin antibodies. Then some paraneoplastic syndromes like lung cancers, ovarian cancers, neuroblastomas, breast cancers, even hyponatremia, decrease in sodium, then alcoholism, nutritional deficiency of B1 and B2. I just hope this is Wernicke's encephalopathy associated, and of course there is cerebellar vermis degeneration which is going to be there. Okay, so just remember like this, like A for alcoholism, B for B1 and B2 deficiency, C for your cerebellar vermis degeneration. Okay, and then so hyponatremia, I'm writing like this, decrease in sodium. Okay, decrease in sodium. So this is A, B, C, D, you have to remember. And then okay, so I'll write E, F and G. So what is G? G for your anti-gliadin antibodies, and you have got some gluten diseases like this. Okay, and FF is something which is called as fatal diseases. So the cancers are actually fatal. So you can remember the breast, ovarian, lung cancers and neuroblastoma. So bolona can be a mnemonic for this. So bolona means B for breast, O for ovary, L for lung, then N for neuroblastoma, A for ataxia. So all these things you can remember. Okay, G I have told you, F I have told you, E for some diseases like your Prine's disease. Okay, so Prine's disease is actually nothing but an encephalopathy only. Okay, encephalopathy. So that's why from E you can remember that. What are the chronic causes? So please remember, you have got Friedreich's ataxia, ataxia telangiectasia, MERRF, and then Spinocerebellar ataxia. Okay, so these ataxias are actually important, like Friedreich's ataxia, ataxia telangiectasia, Spinocerebellar ataxia. So remember, I mean, this is a bad mnemonic, but I am only having this in my brains as of now, so you can remember that farts is actually the mnemonic to remember them. Okay, coming on to the focal cerebellar ataxia. Now, focal cerebellar ataxia, what are the causes of focal cerebellar ataxia? So, focus, some focus is there, like abscess. Abscess is going to have a focus. Okay, there is lymphoma. Lymphoma is going to have a focus. There is a progressive multifocal leukoencephalopathy in AIDS, that is also going to have a particular focus. Then you have got some metastasis. Okay, metastasis is going to be there. Then you have got some hematoma. Then you have got something which is called as cerebrovascular disease. So all cerebrovascular disease is just like a very acute thing to happen. So these things are going to be there. So just remember that cerebrovascular disease, hematoma, abscess formation, your what you call this, metastasis is going to be there, and then you have got lymphoma as well as leukoencephalopathy, that is seen in your what? That is seen in your AIDS. Okay, so in AIDS it is actually which is seen. Okay, so this is the thing which you have to remember. You can create any mnemonic of your choice if you are discussing about the acute diseases. Okay, so this is my mnemonic. Actually, I belong to Haryana, that's a part in India, and we are fond of using a word Chaudharies. So CH stands for that, and Amla is something which you can remember. So this is, I'm not sure if this mnemonic is good or bad, but then this is the mnemonic which you can actually use. Okay, after that you have got something which is called as focal cerebellar ataxia, but a chronic cause, so multiple sclerosis. So what do you mean by multiple sclerosis? So it's actually a myelination issue. Then you have got Chiari malformation and Dandy-Walker cyst or Dandy-Walker malformation. Both of these things, of course, I'm going to discuss with you, but remember, multiple sclerosis is a myelination issue, and that's very important. So what do you mean by myelination issues and multiple sclerosis? So for example, this is a nerve which is going on, and in this nerve what you're going to get, so this is the myelin which is there in the nerve sheath. So if there is no, this is myelin, and the function of myelin is that when the nerve impulse is coming here, it is going to cause the jump of this impulse, and the movement is of this nerve impulses is going to be very fast. But in multiple sclerosis, what happens? There is no myelin which is going to be there, so the conduction is going to be very slow conduction, and that is why there is going to be a disbalance, because the patient wants to raise the leg, but the leg will not be able to pull it up. Why? Because there is decrease in the velocity of conduction, there is delay in the movement. So this was it about the ataxia. Thank you so much for watching, and I'll meet you in the next class.